situation, how many people would actually be in this room while this is going on?
You would have an anesthesiologist and you would have several nurses depending on what the operative procedure was. If there was an operation where the abdomen was being opened and they were doing surgery, say, on the bowel, you would usually have at least one surgeon and maybe the resident that he is teaching. You would then have a nurse that was standing there and assisting. You would have a circulating nurse that is going around and getting other equipment and supplies or taking things away as they're needing to be disposed of. And then you would also have a tech that would be helping out as well. So really a minimum of 5 people, although realistically in a training setting, it's more like 7 to 10.
Now, if you could walk me through the simulation of how the whole system works. Now, we're here in somewhat of an operating room setting, and then I understand that you have computers in another room, in another setting. How does the whole thing work?
Sure. I'm going to have you follow Jeremy over and he'll show you the computers that actually control the patient physiology, and you'll see not only the monitor of what the learner sees, but you'll see the computer user interface where he controls what happens with the simulator as well. So why don't we follow Jeremy?
Okay, Jeremy.
And by the way, they're all linked to these 2 cameras right here that you're going to be seeing.
Okay, oh, I see. So there's a camera on both sides of the lab, and okay.
Okay, and then they would be linked right to this computer here. We have one computer that is specifically designed for, let me shut this down, for recording the scenario.
I'll look around the lab while you're making adjustments. Okay, now I'm coming back.
Okay, this is what we're actually going to record. We have 3 camera views as well as a monitor view, and we can adjust that to where we have 1, 2 camera views and a monitor, or 2 cameras and 2 monitors, depending on what the scenario calls for. This is my control of that mannequin that's in the other room. We have all the same parameters, so I can, with a mouse, I can simply come up here and scroll to change the heart rate. Whatever parameter I want to change, it's just a matter of scrolling. I can circulate a blood pressure by a click of a button. We talked about the pneumothorax and the punctured lung, and that's just a matter of coming over here and clicking it out, and now that patient has only 1 lung that's inflated.
And so it might be useful if you can zoom in just a little bit here on actually what Jeremy's screen shows. This is our representation of what's happening with the simulator, and you can see right now this lung is filling up completely and then deflating. This lung, where he's given the pneumothorax or air on the outside of the lung, as if the lung popped like a balloon, is not inflating or deflating at all, but it's just small. And if we walk back in the other room, we'll see that only one side of the simulator's chest is going up and down, since only one of the lungs is inflating and deflating.
Now, Dr. Denmark, are you the person that kind of sets up the lesson, so to speak, for the students that come in?
It will depend who the learner group is. Most of the time there's a faculty member for that particular specialty that will be here that will worry about the content and what the learning objectives are for those students. We just try to provide the environment to maximize what they're trying to learn. If they were learners from pediatric emergency medicine, which is my specialty, then I would contribute to that. If there are learners from anesthesia, such as we're illustrating in this other room, then there would be an anesthesiologist who has been practicing for some time, who would be here with the learners, would be talking them through the scenario, the procedures, and those sorts of things, and really providing the expertise so that the learners maximize their time here.
Now, Jeremy, this equipment is pretty complicated, especially you got 3 CPUs going, 3 monitors, you've got video that you're monitoring on the top. What was your learning curve when all the new equipment arrived and you had to come up to speed?
It was a steep learning curve for me, but it's been a fun journey, and I feel pretty comfortable with what we have going on now. We've taken each piece and kind of built it in for each specific need that we have. So there's no one piece. I mean, there's no one system that we've purchased to do everything that we do. It's kind of pieced together to meet our needs.
And I see you've got you're running both PCs and Macintoshes here.
Yes, the Mac the system that we use for recording is a Mac-based system,
Mm-hmm.
and so that's running off the Mac Pros here. But all of our mannequins, with the exception of one, are all PC-based. So we have to use the PC to run our Gomard and Laerdal mannequins.
Mm-hmm.
So that's why we have to use both.
Now, in the event that you were sick, is there someone that could actually take your place?
We try to get everybody up to speed so that if I'm sick, anybody could step in and take my place.
Oh, that's a wonderful system you have. Yeah, yeah.
Let me show you, if you want to stay here and watch the monitor for the second, I'll go in and do some things with the simulator so you can see the value of the different views that we try to record to show our learners.
Okay, so I'm looking at a monitor that has several views at this point. Okay.
Yes, this is a match of our recording, and this is each different camera view that we have in there.
Mm-hmm.
And you can see Dr. Denmark here stepping up, and then we can record. We can adjust these cameras using this Sony controller. So I can zoom out and zoom in on what he's doing here, and I can take the camera 2 and zoom out.
Oh, that's interesting. So he's going inside of
what we call an airway box. It has everything that we need to secure an airway.
and so you can see everything that he's doing from every angle.
And I can zoom in here and make sure that whatever he's doing in there is. So he just extubated the patient, meaning pulling that tube out of his lungs, and now he's going to re-intubate the patient. And so we can zoom right in there and make sure that everything is going the way it's supposed to. And if I need to get over here and.
Now, I guess you don't have a need to communicate with him from here to there because you're doing a different job.
If we do, we have mics in there, and we also have earpieces that we can give to what we call a confederate or somebody who is kind of in on the scenario and kind of knows where it's going. So we can give them some instructions in order to help the scenario along or make it more difficult or